Hi, I'm Leah, and I want to go over the changes that are happening to Medicare Part D for 2025. These are some of the biggest changes that have happened to prescription drug plans in over 20 years. I want to explain what's happening and how it may affect you. First, all of these changes are part of the IRA or Inflation Reduction Act that was signed into law in 2022 that are now hitting in 2025. Let's go over it now. I first want to show you a comparison between 2024 and 2025 to give you a reference on how it is changing. So for 2024, there are 4 stages. The first stage is the deductible stage. A deductible is the amount you need to pay before the plan will pay. This being said, many of the plans, depending on your service area, have preferred generics and generic drugs as deductible exempt. Those are Tier 1 and Tier 2 drugs. This means that you only pay the deductible on brand name, specialty drugs, etc. You may be thinking that you do not pay a deductible at all. This is because some Advantage plans do not have a drug deductible. Back to the chart. In 2024, the drug deductible is $545, and in 2025, it will be $590. After you finish paying the deductible, if your plan has one, then you will immediately go into stage 2, or the initial coverage stage. This is when you will pay the co-pays for drugs on the different tiers. You pay less for generics and more for brand names. Here's where we start to see a big difference from 2024. In 2024, when what you pay for your drugs and what the plan paid equal $5,300, then you go into phase 3, which is called the coverage gap, and sometimes referred to as the donut hole. This is when you start paying 25% coinsurance for some drugs, usually drugs on tier 3 and above. This can become very expensive. For 2025, there will be no donut hole. So when your true out-of-pocket equals $2,000, then you will pay 0 and go into the catastrophic phase. In 2024, you do not go into the catastrophic coverage until your troop is $8,000, and then you do not pay any more for medications. So the big changes for 2025 is 1, there is no more coverage gap or donut hole. 2, there is a $2,000 annual maximum on drugs. 3, you pay 0 for catastrophic coverage. And 4, there will be a monthly payment plan option. I will get into that more in another video, but what this means is you can spread out the cost of your medications throughout the year and instead of paying a big lump sum when you go to pick up your medications. I think that these changes will be helpful for people who are consistently going into the coverage gap and seeing their cost of medication skyrocket. It may not be helpful for people who are not paying that much for drugs. Why do I think this? Because the burden of paying the cost of the prescriptions is now on the insurance companies. So I believe they may increase the cost of drug plans. I will know more about that when I'm able to review all of the plans for next year. Probably I'll be doing that next month, but I won't be able to tell you about it until October 1st. So stay tuned for that video and like, follow, and comment for more videos like this. As always, if you have any questions or need further help, you can reach me at 714-880-8161, or you can go to my website, www.easydayinsurance.com.